The number of children contracting COVID-19 has increased fivefold since the end of June, with a substantial 84% jump in the last week alone, according to a new report from the American Academy of Pediatrics, which comes as numerous states report upticks in child hospitalizations amid the ongoing Delta surge. Major children's hospitals in Alabama, Arkansas, Louisiana and Florida, states that have been battling a broader increase in hospitalizations, all said last week they had more children in their care than at any other point in the pandemic. As there is no regularly updated, comprehensive data on child COVID-19 cases available, it's unclear whether the rise in hospitalizations is occurring nationwide. The last report from the Centers for Disease Control and Prevention (CDC) in early June found hospitalization rates among children peaked at 2.1 per 100,000 in January. Meanwhile, the American Academy of Pediatrics, which acknowledges it is missing data from some states, reports the number of hospitalizations has remained steady throughout the pandemic, with children accounting for between 1.3% and 3.5% of hospitalizations, depending on the state. Overall, the risk of death and hospitalization among children who contract COVID-19 remains low. Just over 520 children have died from COVID-19 since the start of the pandemic, 0.08% of the US's 612,000 total deaths, and only around 0.01% recorded cases result in death. However, the CDC highlights it is still possible for children to suffer from severe disease as it occurs in all age groups. Experts have floated numerous explanations for why child hospitalizations appear to be on the rise, with many pointing to the trend of younger people making up a larger proportion of new cases. Children under 12 are also unable to get the vaccine. Meanwhile, inoculations are severely lagging among teenagers and young adults for whom the shot is available. Whether the combination of surging COVID-19 and RSV cases may overwhelm hospital pediatric units. After steadily increasing since early June, cases of RSV saw a larger spike over the past month according to CDC data, prompting concern from some public health experts. Dr. Heather Hack, a pediatrician at Texas Children's Hospital in Houston, recently detailed in a series of Twitter posts how the surge upon surge is impacting her facility. After many months of zero or few pediatric COVID cases, we are seeing infants, children and teens with COVID pouring back into the hospital, more and more each day, Hack wrote, explaining the hospital also has winter-level patient volumes of acutely ill infants, toddlers with RSV. I worry that we will run out of beds and staff, she said. Hospitals in southern US.